We talk about a comparison of Eastern and Western medicine. Eastern medicine developed from empirical observation over thousands of years. And part of the reason why we were able to do that in terms of the Chinese program is because they built a wall, they had an emperor, they protected their empire. They were very civilized when it came to things, even though they had lots of wars between people. The key is that they maintained the contiguousness of their history. In the West, every time somebody would get bigger and badder, they would come and fight each other, and they would kill off all the smart people, and they would sort of lose what they learned. And so, unfortunately, there was a loss of the science that went on. Today, we look at Western medicine and we talk about this scientific method or case-based medicine. And that's this evidence-based thing that we're really here to talk about today. But remember, that's only about 250 years old. Back in ancient times, we did the same thing. We made empirical observations. We figured out what worked and what didn't work, and sometimes we got down to that. And so when we look at evidence, we look for the best that we can. But it really, to me, gets down to sort of a struggle between the technology medicine. Western medicine has become very technologically advanced. We have MRIs to look inside the body. We've got ultrasounds. We've got all these different modern tools that we can use, which I really didn't have in ancient China. But at the same time, it has gotten to the point where we start using the tools and ignoring the patient. And so, to me, the nice thing about Chinese medicine is that it has kept the art of medicine, and that's really where I think the struggle right now is between the art and the science. You know, when we look at scientific method, though, we get down to the point where we talk about, meta-analysis, clinical trials, randomized clinical control trials. We look at the best evidence. But ultimately, when it boils down to patient and clinician, it's down to what the clinician believes is best for that particular patient, and that's really the same thing. That's where the art of medicine comes in. In West, we look at molecular and organistic view. We look at, cases where we say, oh man, this is really a bad liver. Well, livers are just livers, and they're good or bad. A holistic view looks at the whole animal and says, I have this animal who's suffering from a bad liver, and I need to fix that so the rest of the animal's in better shape. And so we tend to look at things a little bit more holistically in things. The other thing gets into sort of physics. When we look at Einsteinian physics, that changed everything because it said that energy and matter were equal. That makes it very circular, and that's sort of the typical thing that we see in Eastern medicine, whereas in Western medicine we sort of look at it from a Newtonian point of view, where everything is equal and opposite. So we have bacteria, we have antibacterials, we have fungus, we have antifungus, we have cancer, we have anti-cancer. So we have all these different medicines that are directly in opposition for the disease that they're trying to fight. So, if we wait till there's already disease, sometimes we have to use these very powerful tools. But if we actually recognize the energy of the system was abnormal in the first place, we could fix the energy so that the structural change never occurred. And that's what I really like about TCVM. So it's much more energetic in the way that it works, whereas Western medicine is much more mechanistic. But again, I think the big problem lies between sort of this art and technology of medicine, which is where we fight over what is the best for the patient. Well, acupuncture comes from the Greek acus, meaning needle, and pungari for piercing. So acupuncture is piercing the body with needles. In China, it's Zhenjue, which basically means both needles, Zhen and moxibus, Zhenjue, and those were designed to manipulate the energy of the body, regulate the qi, or the energetics of the body, to essentially make the body more naturally whole and to heal. Moxa is a very interesting herb. It is basically mugwort. It smells like marijuana when you burn it, so it's a good idea to put a sign out, we moxa here, so they don't think you're in the back toking. Now in Colorado and Washington, you don't have to do that because you can get marijuana on the street, but moxa is unique. It burns at 1500 degrees Fahrenheit, and so it was used for treating arthritic joints. They decided to do a study where they actually compared moxa versus a heated element at 1500 degrees Fahrenheit, so they were the same temperature. They burned moxa in the room so that you couldn't tell the difference. The people weren't able to see whether they were being treated with a hot iron or with moxa. And what they found was that moxa provided a much better and longer lasting effect. So the mugwort, by using its energy to heat the joint, actually provided a longer standing effect because there's some energetic imparted by the herb into those tissues. Well, I looked far and wide for early evidence scientifically, and I think this is the best example I found early on. This fellow is being treated along his bladder meridian, and he says, "Oh, that's very odd. My neck finally feels better." So certainly early acupuncture is one of those things that's around. In fact, the Iceman found in the Alps was a frozen individual, and when they looked at him inside his little medicine bag, there was some medication or herbs that he could take to actually treat pinworms, which he had. So it is very possible that he knew he had something and he was actually carrying around the herb to treat it. He also had a tattoo on an acupuncture point in his back, which he could not have placed himself because it was in such an awkward position. And it was at an acupuncture point which would be used for treating sciatica. And when they did a MRI of the Iceman, they found that in fact he actually had a disc protrusion there. So it may well be that in the West that we actually understood acupuncture, but by the time Hippocrates came around and said, what we need is some good herbs, good diet, exercise, and rest, and that would make us stay healthy, so that he became the father of modern medicine. The Yellow Emperor at the same time was saying the same thing, but he also added, and you should do acupuncture. So, that's one of the things that probably was lost in the West because of our warring nature. Well, if we look at the Medline or PubMed, and we look at sites for acupuncture from the beginning, there were about 460 from year 0001 up until 1964. So I don't know when those occurred, but they were pretty spread out. Medline didn't start until 1965, so from then we actually have pretty good data. And what was happening is you were getting about 20 per year up until 1972. And then an event took place. Nixon went to China. So President Nixon did a lot of really good things. He taught us not to trust anyone. Okay? He also ended the Vietnam War, so I'm glad that I didn't have to get involved in that conflict. And he went to China and opened China. There's a lot of stories about what happened in that process, but I think the appropriate one is that Nixon was well read. He liked to read the New Yorker, and there was a reporter for the New Yorker who traveled throughout China, and while he was in China became very, very ill to the point where he was worried about needing to be actually emergency airlifted back to the United States. And while he was there, he was treated by Chinese practitioners with medications for this illness, and it actually made him much better, so he was able to stay and finish his job reporting there. And so he reported on his experience with Chinese medicine and how it actually helped him so that he recovered from something that in the West he would have been extremely sick and ill from. And Nixon, having read that, when they went to China, he asked his people to actually look into it. They saw some of the surgeries being done with electrical acupuncture without anything other than the acupuncture itself. And he said, this is something that we should bring back and study. And so when he returned, there was a gradual increase, but the increase from then until around the year 2000 was at about 300 per year. So that's a fairly significant increase. It's a little over a 10-fold or 15-fold increase over what was being done before his visit. More importantly, prior to 1972, there were really no scientific studies, what we would consider scientific. If we consider meta-analysis as the top of the category for evidence-based medicine, randomized clinical trials, the scientific reviews which look at data in strong ways and look at multiple center trials and things which gives us the best evidence. And if we look at those, we didn't really see those prior to the time that Nixon went. So when he came back, and because of that interest, they actually began to increase the amount of studies. Then in around 1999 to 2000, we also had another upsurge, and at that point it was because NIH started the Institute of Complementary and Alternative Medicine. And when that institute was there was a place to help accumulate that information, a place for people to apply for grants through it and other agencies, and to do specialized grants looking at that. So money was made available by Congress and through the NIH to actually become more aggressive in its study. And so since that time, we've had about 1,500 sites per year, but more importantly, 25% of those represent real science. And so right now, there's really approximately 30,000. It was about 27,000 at the beginning of this month, and I believe by the end of the month we'll be at 30,000 for this year, so that we will end up with a lot of sites related to medicine. Now, also we're finding more and more sites in animal medicine. They represent about 1/10 of the total, but more importantly, we're beginning to see now more and more scientific studies in the animal field as well, so that we actually have data that says that we are actually improving the outcomes for the scientific studies. So there's a lot of good information. So when people say, where's the science? You can say, go to PubMed. It's there. You'll find it. Okay? Well, another thing that we need to consider is there's been a lot of discussion about placebo. And placebo is one of those things which is very interesting. If you go to a person and you say to them, I have something here that I can give you that will help you, 30% of those people will actually be helped. Not that they think they're helped. They actually will improve or recover from their illness with nothing but, say, a sugar pill. It has to do with their belief. Moreover, if the doctor believes that what he's giving them actually helps, 40% will get better. So there's actually something imparted by the belief of the physician as well as the belief of the patient. Now, that isn't as powerful as the nocebo effect. The nocebo effect is I go to you and I say, I have this medicine. I don't think it's going to do you any good, but it's the only thing I've got, so I might as well give it to you. But don't expect it to work because it's just a medicine, and I just had to pick it off the shelf because I got nothing else that I can give you, so I wanted to give you something. So the people, when they actually believe that medicine won't work, that medicine could be morphine, and their problem could be pain, and it actually won't help their pain because the nocebo effect blocks the benefit of morphine. That's even more powerful than when we look at the placebo effect. So our experience and what we tell people does have an impact. It's always good to be hopeful and cheerful and to be optimistic and provide people with true hope that we can actually help them. So the other thing about placebo is that if we look at a problem and we measure something quantifiable, not a question about how did it make you feel, but measuring perhaps a blood change that indicates how it made you feel. In other words, we could measure endorphin levels, or we could measure serotonin levels, we could measure white blood cells or other chemicals in the body to indicate whether there was truly a change. That is not subject to placebo. Researchers can fudge data and lie, but data doesn't. Data is just data. It's only our interpretation that changes it. So when we look at things that have a quantifiable change, there is no placebo effect, and blindedness then does not become a problem. Now that's important for us because in animals, we can't, hide treatments from the animal per se. We can't ask them subjective questions, so a lot of times we have to rely on hard data. But if we rely on the data of the owner, where they are subject to placebo and nocebo effects, we have to be careful in the way that we handle that, because then we would have to do it. So if we did a questionnaire with people, we have to be, which is subjective data, that does have to be blinded. But if we're measuring objective changes, those are something where blindedness is not important. Well, back in 1997, and I realize this is a fair time back, but it's the only time that NIH has actually done a consensus on acupuncture. I think that today, if they did that, it would be even stronger and more powerful. But what they really said is that there is absolute data to prove that acupuncture is effective for treating osteoarthritis and musculoskeletal pain. And actually, if you talk to NIH today, what they would say is acupuncture is one of the modalities for pain control and management. They don't recognize that it does all the other things that we do, but we're beginning to develop and accumulate much more data, which is going to change their perceptions. And we need to make sure that we change that, because there was evidence even back then where they said, we believe it is effective for treating many GI problems. We'd just like to see more data. And those problems were inflammatory bowel disease, diarrhea, ulcerative colitis, peptic ulcers, dyspepsia, abdominal pain, nausea, and vomiting. You know, if I were a horse, that's their GI. You know, certainly a lot of dogs and cats benefit from the things that we can do in acupuncture. And it's just that we recognize that not only is it managing the pain, but it's also managing the interaction of the nervous system with that. So they didn't feel that that was absolute data, but they felt that there was enough data to suggest that it needed further study, and it probably was effective for that. Same thing for pulmonary disease with asthma and cold. It was probably effective for those, but they did want to see some more data. They also believe that it would be effective for immune modulation. That would reduce inflammation, elevate white blood cells when needed, increase interleukin-2 production, among other things, and that those were things where there was pretty good evidence that it did these things, but they wanted more evidence. Same thing, it's effective in reproductive orders, including decreasing uterine bleeding, synchronizing ovulation, which is how we use it in many of our large animal species. These are the things that we do to regulate the autonomic nervous system, and I'm convinced that they actually are true. It's a matter that the science is now beginning to show more and more solid evidence that, in fact, this is the case. So while the view of NIH is still, I think, a little bit limited based upon their original consensus back in 1997, it's about time for us to force them to have another consensus and to present more data so that they will actually broaden their view of acupuncture and recognize that it is valuable for more than just what's there. Now, how does acupuncture work? You know, it's not just a simple, explanation of one system. It involves the nervous system, the endocrine system, and the immune system. It's a little bit of all of those. And it's the combination of the effects of all of those that it really does. Of course, it starts by working through the nervous system, but the nervous system is interconnected to all these different things, and that's the reason why it has such a powerful impact on the body. So it's pretty simple in context. You put a needle into the tissue, okay, and it causes tissue damage. That local tissue damage, from a Western point of view, is the strongest power that we can have. In other words, if we have a problem in our elbow, treating the elbow is obviously going to have a big impact because we're treating the problem. In addition to that, it says that there's connections with nerves that go to that. So there's this segmental connection between the nerves that go to the elbow, particularly in regulation of pain and blood flow and other changes. So if we stimulate those segmental nerves, that will have the second biggest impact. They kind of ignore the rest. What we know from Chinese terms and what we now know in Western terms, that if we stimulate distant points, we actually can affect areas of the nervous system that do things like affecting the placebo areas of the brain, so that if the local and segmental points are used and these placebo areas get activated, we actually increase the benefit that we're looking at in the areas that we're talking about. So while it starts as a simple local effect, it is going to then spread and involve the entire neural axis throughout the entire body. So that's the beauty of acupuncture. While it might be very simple and it might start as a local effect, it is going to broaden until the entire neural axis is involved. Now, We are going to look at some of these events in a little bit more detail in this lecture and the next. And when we do that, what we really are going to do is sort of talk about local effects. We're going to talk about segmental effects. We're going to talk about central effects. But one thing I want you to remember is these are all taking place at once. So all of this happens at the first insert of that needle, and then we see everything take place simultaneously. Now, Dr. Shea has talked about the basic tenets of acupuncture. And the basic tenets of acupuncture are that it is dependent upon the point you select, it is dependent upon the method that you use to stimulate, and it is dependent upon the length of stimulation. In other words, it is spatial. The point you select has a specific point-by-point change. It is temporal, meaning the longer you stimulate, the broader the effect is, and that the method of stimulation might impact how much of a stimulation length is needed because some are stronger than others. And so we can see dry needles have some effect. We can see electrical acupuncture has a broader effect. When I first started in acupuncture, I told Dr. Shea I didn't really want to do, electrical acupuncture because they didn't have that in ancient China, and he said, well, yes, but we manipulated the needles. And so the reason you'd have the master and lots of minions who were helping is because he would teach each one to do certain manipulations to create what you're doing with the electrical acupuncture. So that they stimulated the needles to actually generate the sensations that we see with electricity. But because of all the manipulations using their hands and fingers, a lot of times the master would end up with arthritis at the end of the day. And so he said electricity provides the ability to do that without manipulation, and you can do it much longer. And that made sense to me, and so I switched and started using electrical acupuncture as well. Aquapuncture, putting B12 saline or other compounds in an acupuncture point, does have an impact as well. And then there's also hemoacupuncture. Hemoacupuncture, the point is actually in the vessel, and so stimulating that point actually changes blood flow, and that can be very important, particularly if we're dealing with certain areas. So an example of that is governing vessel 26, which is at the base of the nostrils and the center of the philtrum. In dogs, it's in their muzzle, and it's not at the non-haired, it's up in the middle of that philtrum at the level of the base of the nostrums. And if you take that point and you stick a needle in it and you bounce it off the bone as a strong stimulus, that will result in epinephrine release, is why it's a resuscitation point. But if you twist that area and you twitch it, it actually causes endorphin release. So when we put twitches on noses of horses, they're not going, oh no, it hurts, I won't move. They're going, oh, it makes me feel good. And so actually they enjoy that because they're actually getting endorphin release in the brainstem, which actually calms them down and changes their neurochemistry. So it is something which is related to the way that we stimulate. That's one of those tenets, for example. Well, now that we have magnetic resonant image, and I always said if the Chinese had invented that 8,000 years ago, we'd all be Chinese. But the key is that magnetic resonant image is something that's relatively new. The first image was taken in about 1980, and it looked like, the thing that was on Poltergeist, where she says, "They're back," So it's just a little fuzz in the background of the white. But they began to modify that so that we can actually look inside the body and see the changes in soft tissue. So doing that, they have lots of different methods, some of which is related to oxygenation and blood flow. Some of it is related to this technique that was used in rabbits to sort of identify some of the aspects of acupuncture points. And so what happens in this process is this is sort of a baseline MRI where everything just looks like a brain, and this is actually a T1 weighted image. They then inject mannitol into the carotid arteries, which breaks the blood-brain barrier, but doesn't really change the characteristic of the brain. But by opening the blood-brain barrier allows them to infuse manganese ions into the brain across that barrier to sort of lock them in place. And so Then when they're locked in place, if you stimulate the nervous system, the rate of release of the manganese ions gives you a clue about the metabolic activity of that particular region. And so by stimulating gallbladder 34, which you'll remember is right in front of the fibular head, you could stimulate that in the rabbit with electrical acupuncture, and you could actually see a specific change in the nervous system related to that. So this is evidence that the stimulation of a distant point actually affects the brain. Well, not only that, but if we compare the gallbladder 34 and stomach 36 is just off the tibial plateau in the muscle, about a half a twin off the midline in a nice linear groove. Now, again, in a rabbit, the fibular head and the tibial plateau are only millimeters apart. But by stimulating those two different sites, what they found is a completely different pattern in terms of the activity that took place in the brain. So it proves that these points have a spatial recognition in the brain, and that's one of those tenets of acupuncture. The point you select has a different effect in the nervous system. Well, they also stimulated for a longer period of time in both of those points, and if you start out, there's a little bit of change, and as you continue to stimulate, that change broadens to involve more and more of the cerebral cortex. And so it does have a temporal effect as well. That's the other component that we saw related to it. In a separate study, they looked at the difference of analgesic points, and so they looked to see where do points that have a history of analgesia affect the brain. What parts of the brain regions does it affect? And it was the periaqueductal gray, the hypothalamus, the thalamus, other regions of the nervous system that actually are associated with pain regulation mechanisms that we know are associated with pain control. So it does seem that those points that provide analgesic property when you stimulate them, that they in fact affect areas of the nervous system from other physiologic studies that we would anticipate being activated if we were going to have pain control. And if we activated non-analgesic points, it did not activate those regions of the brain. So the reason they weren't analgesic is because they didn't affect the areas of the brain associated with analgesia. Okay? So that again sort of says that the points that you select will have a different type of effect. Now, looking at that, there have been documentation of about 36 points right now in terms of the characterization of what they actually do to the brain using functional magnetic resonance, at least in animals. And because of that, it does say that at least a tenth of the points that have been studied have been characterized by having these effects. And I think that's a pretty good, randomization of selection to say probably many, many, many of the other points fall into that same category as well. Well, Bill Muir and his group at Ohio looked at acupuncture. He was a good anesthesiologist there for a long period of time. And so they looked at stimulating bladder 20 for animals who had colic. Bladder 20 is the spleen association point, and so it's one that we use to help regulate digestive activity and to help with the gut and provide analgesia. And if they used dry needles or electrical acupuncture, either one of those techniques did provide analgesia for the horse because it's providing segmental support. But only electrical acupuncture caused the release of endorphins into the bloodstream because it's a stronger stimulus and had more of a powerful central effect. And so the method of stimulation also affects the outcome of what you see. So we have examples of that with governing vessel 26. We also have an example of that with bladder 20 and other points as well. Now, when we look at medication, now that we have medication that we can take once a day, a lot of times we sit there and say, okay, I have inflammatory bowel disease and I've got this medication that says take it once a day. When should I take it? Well, in studies that have been done recently, they asked that question too, and they started to look around the clock trying to figure out, they'd actually wake the people up at 1 in the morning or 3 in the morning or 2 in the morning and have them take their medicine. They'd give them a washout period. They'd go through this again and again and again until they could kind of figure out when was the optimal time for doing that. And interesting, with inflammatory brain disease, it was 6 a.m. When they looked at asthma and medications for asthma, they found it was 4 a.m. And if we look at medicines that are taken for specific reasons, and we combine it to the Chinese clock, you could predict the timing for when you should be taking that medicine based upon your Chinese clock, because those are the times when that organ needs extra support. And so if you had a lung problem, taking medicine during that time builds up more energy to the lung and helps protect it. So, those are things that is interesting, that when we start looking at even the Chinese clock and comparing it with our new modern medicine and methodologies, it's amazing, because the people who did that had no idea about that. It was the observations of the TCM people who began to recognize that was what was actually going on. And so we're seeing lots of correlates between TCM and the medication clock. Well, anatomically, we want to talk a little bit about different structures that are involved in acupuncture. The acupuncture point used to be a bit of a mystery, but actually the acupuncture point for large intestine 10 and also large intestine 4 have actually recently been isolated. And what we find is that they are these communication outlet areas that in China is called zu shui, which is a deeper point. Deep in that point is what we call this neurovascular bundle, where there's a complex of capillaries and nerve and vessel, artery and vein, and there's lots of things that are going on in that. There's high densities of nerve endings, arterioles, lymphatics, and mast cells. That's one reason why in us, if we put a needle in an acupuncture point, a lot of times it gets red around the needle. It's not because it's bleeding, it's because it's causing degranulation of mast cells, which are releasing histamine. So you're getting a little histaminic wheel around that. That's part of what triggers that response. If we measure the electrical resistance of skin, about 70 to 80% of the points in man and animals correspond to acupuncture points. And these points with these little point finders that are used to try to find the acupuncture point are the places where there's a decrease in electrical resistance, an increase in electrical conductance, and if we dissect deeply to that, it's where we find these neurovascular bundles. So we do know that there is actually a true structure which probably represents the acupuncture point, and it is where these free nerve endings are and these mast cells to create these issues. They also are located where nerves divide or penetrate the body fascia. So if we look at nerves and we know the course of nerves, we can generally predict where there might be an acupuncture point, because any place where that nerve penetrates through the skin or where it divides and splits into a plexus is where we're going to see the presence of the acupuncture points. So in cows, they went and they took a look and they said, okay, here's where the inner and outer